Hello everyone. Let's talk about the pancreatic cancer and how it causes mortality or death. Cancer of pancreas or pancreatic cancer is the third leading cause of cancer-related death in the United States. Pancreatic cancer has high mortality rate. It has around 40% mortality rate in the tumors that can be removed by surgery. The survival decreases to only 5% in population that their tumor cannot be removed by surgery or has already spread. Why this cancer is so deadly? Because it stays without any symptoms or stays silent for a long time, and when it's diagnosed, it's already very late. Let's see how pancreatic cancer causes death. To make it simpler, I categorize the causes of mortality into three major pathways. The first pathway is mechanical effect. Pancreas tumor or its metastasis can directly affect organs around it and cause obstruction or compression. Further, pancreas tumor can invade other organs such as big vessels. This may result in bleeding and fluid accumulation around vital organs such as the stomach and result in obstruction. Further, it can cause blocking of the food pathway and result in malnutrition. Lack of proper nutrition will result in consequences such as weaker immune system and easier progression of tumor and adverse events such as infection. Let's illustrate here. This is our pancreas. On the left side is the head, on the right side is the tail. And the organ in front of it is the stomach. The tumor can happen anywhere, on the head, the middle, and the tail. When it's on the head, it can cause compression either on the stomach, end of the stomach, or beginning of the small intestine, which we call duodenum. So, pancreas tumor can cause direct pressure to the first portion of the small intestine and even liver and result in obstruction in small bowel and other organs such as liver, which I will discuss later. Here we are talking about the stomach. So how we treat this patient? Besides treating the cancer, we use tools to prevent the stomach and a small bowel to completely remain closed. The procedure is called a stenting that can be inserted into a small bowel. So they put a stent in this area and prevent further obstruction. However, this stent can cause also problem too. It can go back and forward or it can bleed. The other pathway that pancreatic cancer can cause death, or the second one, is called indirect effect. Tumor cells, they produce substances in blood. These substances or molecules are normally produced by normal cells with a specific function. For example, we have cells in our blood and in walls of blood vessels. These cells, they produce mediators or substances that they have different functions. For example, they can result in clot formation and prevent bleeding. However, they produce them during specific circumstances, such as injury, to prevent bleeding. But cancer cells are not normal, and they produce unrelated molecules without uncontrolled amount. So cancer cells are technically crazy, and they produce a lot of different stuff that can harm our body. So it can cause clot formation without control. So this excessive production causes unnecessary blood clot formation and hence result in adverse consequences. So for instance, blood clot can form in legs that can migrate later to lungs and cause occlusion in the lung vessels and decrease lung functionality. And end result is lower functionality of the patient's vital organs and easier death. Another example is clot formation in vital organs such as small or large bowel vessels or even liver that result in lack of blood flow and ischemia in this organ. For example, the blood vessels can be occluded by the clot formation, and then those organs that can around the clot can be affected, We call them ischemia or lack of blood. The third pathway is metastasis. Tumor of pancreas can metastasize to vital organs such as liver. Also, it can metastasize to other organs such as stomach too. There are multiple organs, but these two are the most common sites of metastasis. These can cause liver failure, but two different mechanisms. Let me illustrate. This is, for example, our liver, and one of the byproducts of liver is bile that accumulates and is excreted via our gut or goes into our urine, which is different pathway, and I can explain later. However, the main point here, the tumor can metastasize to liver or even inside this lumen. So what happens is that we have blockage. When there is blockage here, all this substance is going to go backward into our blood, and they call it jaundice. And also, on the other hand, metastasis to liver can gradually destroy the liver and result in liver failure. What we do in circumstances that we have obstruction, again, we use a stenting. But as I said, this stenting has its own problem. It can cause bleeding, it can block by itself, or it can move forward and backward. So this was all about how pancreatic cancer can result in death. I hope you enjoyed today's lecture, and I see you in the next video. Have a nice one.